So there is one question that I wish everyone knew to ask their doctor, and most people never do. I had a patient this morning who shared with me that she had had the same diagnosis 5 times in 3 months, and every single time she would get a prescription, she'd take it as directed, go home, feel better for a few days, and then it would pop back up again. I go into the room, I can tell that she is pressed for time. She's got her 2 kids, it's 8 a.m. in the morning, and she says right from the jump, I have a yeast infection. I just need a medication and I'm trying to get my kids to school on time and I gotta go. And I was like, I hear you. I just have one question. Has anyone else looked into why you keep getting a yeast infection back to back? She was like, nope. Can I test you for one thing? I could tell that she was really confused and she was like, for what? I was like, diabetes. And she's like, what is a yeast infection have to do with getting diabetes? And if your blood sugar is uncontrolled, what can happen is it can increase your risk for getting yeast infections. Why? Because yeast loves sugar. And if your blood sugar is uncontrolled, you're going to get a lot of yeast infections. And I can test you for it in 10 minutes. I promise if it's negative, I'll get you out of here. I'll get you your medication. She was like, okay, I'll do it. For context, there is a test called the hemoglobin A1C. Prick your finger, you find out in about 10 minutes if you have diabetes or not. If the number is less than 5.7, you do not have diabetes. Fast forward, get the test back. I check it. Her number is 8. She has diabetes. I share this with everyone because it is so important to ask your doctor, especially when you are dealing with something that continues to come back, nothing's making it better. Ask your doctor, I'm curious, could there be anything else that is connected or related to me having this issue back to back? Every doctor has what's called a differential diagnosis. I like to call it a running list. And that is 3 to 5 things that could be connected to a symptom that you're experiencing. And by asking that, you can find out the root cause of why you're dealing with something that you never dealt with before.